Hello, I'm George Perry, and we're going to continue on with our goal for reviewing implants A to Z, and we're moving on to Section 2. In Section 2, I consider this one of the most important things for a restorative dentist. If you want to spend any time, it's learning how to take a good impression. I believe one of the biggest mistakes we've made as restorative dentists is try to oversimplify that. The other issue that we want to look at is really the head of the implant. That's what I call the bottom line. When the implant is placed, trying to go beyond the head of the implant is extremely difficult. Of course, there's some implants that you can even prep the head of the implant, but that's not our goal. So where the implant is placed, the bottom line, how we use the head of the implant really describes how we're going to restore the case. External connection, internal connection. There are definitely advantages to different types of connections, and we'll look at those advantages. But I want to point out that it might be surprising from a restorative point of view, some of the biologic advantages of some connections don't necessarily translate to restorative advantages. And we're going to look at every one of these implant heads and try to come up with different reasons to use them. But as I said, the bottom line is learning how to take an accurate impression. For me, being predictable, knowing what I can achieve from a single restoration to a full arch is having an accurate impression. And how do we do it? There's a lot of different levels to do it. We're going to talk about the terminology of taking an impression at the abutment level, using closed tray impression copings, open tray impression copings, taking an impression, which I really prefer, at the implant or fixture level, so we go right to the bottom line and find out what we can accomplish for the patient. And then our technique really involves linking those impression copings together. At first it might seem like some excess redundant work, but that's what really gives us the confidence that we can get a great final impression. We need to also look at some of the challenges that we run into as restorative dentists. We try to place an impression coping and it touches an adjacent tooth. How do we manage that? How do we achieve these linked copings? How do we do those in the most efficient way with our patients so that we don't waste time? We need to be efficient and predictable with our work. But achieving that accurate impression is really the bottom line. We look at subtle things like, what if there's saliva on the impression coping? How does that impact the final impression? And it impacts it significantly. So we need to make sure that just some basic techniques are followed. We use GC Pattern Resin to achieve a linking in here of just 2 impression copings, but can we translate that to a full arch? And yes, we can. Different type of technique, different way to manage the patient, but we look at that. Where the bottom line is, we get the accurate impression. So lots of little techniques, lots of little things to carry you from the head of the implant to an accurate, predictable master model.
For more education programs, visit the Guide Institute at www.guidedental.com.